Minnesota is being hit hard by the coronavirus, so much so that many hospital workers are fearing a doomsday scenario is on the horizon. On Friday, Minnesota's health department reported more than 6,800 new cases, bringing the state's total to more than 252,700 cases statewide. They also reported 68 more coronavirus deaths in the state in just one day. Joining us now to talk more about what's happening in Minnesota and around the country is Dr. Cindy Firkin-Smith. She's the president and co-CEO of Caris Health. Dr. Smith, thank you for joining us. The numbers coming out of Minnesota sound dire. Tell us what it's actually like to be there. What are you and other frontline workers seeing in these hospitals?
Hi, Lana. Thanks for having me today. I work in rural Minnesota. I actually am CEO of a small health system, and I talk with frontline healthcare workers every single day that are taking care of COVID patients, and they're stressed beyond belief. They're watching incredibly ill patients not being able to breathe. They're having difficulty finding enough hospital. We have enough hospital beds, we have enough staff, or we have enough stuff, we have enough facilities to take care of these patients, but we're really struggling with having enough people to take care of them. We're stressed, we're overworked. The physicians and nurses and environmental services workers, everyone's working very hard to take care of these patients.
Thank you for all that you and other frontline workers are doing.
Thank you.
On that. I appreciate that you are coming in as somebody who represents some of these rural hospitals, because we know that so much of the country, especially in rural areas, the concern is that despite the best, most extraordinary efforts of frontline workers, that the resources are simply different and that these areas are being hit especially hard. What is the toughest thing that healthcare workers, particularly in rural areas like yours, are dealing with right now?
So in our community, last week, we were testing multiple patients. We tested, in our organization, we tested over 10,000 people last week, and our positivity rate ranged between 22 and 30%. In our community, we were testing a positivity rate of 30%. And what that means is almost 1 in 3 people that we were testing is positive. So conceivably, 1 in 3 people in our community could be positive for COVID. Of those people that test positive in another 2 weeks, those people are going to be ill, and up to 10% of those people could potentially need hospitalization. The challenge we have is that we just don't have the staff to take care of those people. We're simply overrun. At the beginning of November, for the first 14 days, we were on divert in our hospital for up to 11 times during periods of time during those 14 days. So what that means is when we see a patient in the emergency room that's desperately ill, we don't have the staff available in our hospital to admit that patient. We might have an empty bed, we might have an empty room, but we don't have the staff to take care of them. So what that means is we're looking for beds all across the state of Minnesota that have staffing available. Minnesota's been extremely coordinated in taking care of patients, working together, but this is a problem that's happening across our state. And we're very concerned that we're reaching the turning point where, from a collective, we might not have the staff available to take care of the patients that are critically ill and need our care. And it's incredibly stressful for healthcare workers who've dedicated their entire life to know that they just don't have the capacity to take care of people that need their help. You can't imagine what that feels like for a person who's dedicated their life to doing that, to seeing somebody who needs their help and not being able to give it.
I wanted to ask you about the 1 in 3 number, but even before that, just continuing on what you said, I can't imagine how that must feel. What kind of impact is that having on your workers, on the families of these healthcare providers and frontline workers who are trying so desperately to swim upstream?
Well, they're exhausted, as you can imagine. They've been doing this for the last 9 months. Healthcare workers haven't gotten a break for 9 months. And so it's been a constant battle. I honestly think, Lana, what's more stressful even for them than caring for the patients, which is stressful enough, but they're used to that. I think one of the biggest stressors that healthcare workers are facing now is that they're working every single day, doing everything they can, and they feel like they've been abandoned by the community. And what I mean by that is when a healthcare worker, a nurse, a physician, a nurse's aide, a respiratory therapist is doing everything they can to keep somebody alive, doing everything they can to take care of every single patient that needs their care. And at the end of that day, when they're bone, tired and exhausted, going home, they stop at the grocery store and they see people not wearing masks. It's incredibly demoralizing. Healthcare workers are not the front line in this battle. The people in the community are the front line. The way that we're going to keep people alive is to keep them well, to keep them not infected, and keep them out of the hospital. And right now, the only way we have to effectively do that is to keep your social distance, to mask up, to wash your hands, to stay safe. And so when we see people in the public that aren't doing that, honestly, it's heartbreaking. And I have staff going home at the end of the day just wondering how they can do it again the next day. I'll be honest.
Thank you for sharing that with us. Because it does tie into what I wanted to ask you about when you said 1 in 3 of the people that you're testing are coming back positive with coronavirus, and people think rural communities, people are spaced out naturally, that there's less gathering points, but then you explain that community spread is still happening wantonly in some cases. Obviously, another big point of news is Governor Tim Walz's shutdown going into effect on Friday night. Do you think that that is going to help stop this spread, or do you think that there needs to be almost a philosophical shift, a community-wide mental shift about the coronavirus pandemic and the seriousness of it?
There's a lot to unpack there. First of all, we are incredibly grateful to Governor Walz and the leaders in this state for doing the best they can to make extremely difficult decisions. We know how hard this is. We know that when businesses aren't running and people aren't working, they can't pay their bills, they can't buy food. And we know as healthcare workers that means people can't be healthy either. So we understand that. So we know that people need help from our national government during this time of great economic need. But we do know that Governor Walz is following the science when he shuts down, for instance, bars and restaurants, because data clearly states that that's where people and when people are catching the virus. We have been following our own contact tracing of our workers. And by the way, throughout our system, Caris and CentraCare, we have 10% of our workers out either with COVID or on quarantine or caring for someone at home with COVID or on quarantine. That's 1,200 out of our 12,000 workers. That's another reason why we're very stressed with staff, is because they are having the same problems with catching COVID as other people in our communities. And so we know that if we can reduce those environments in the community where people are catching COVID, we can reduce the spread of this virus. We also know that if you wear a mask, if you follow the safety precautions that have been recommended, we can reduce that spread. And we know that quite clearly because our workers aren't catching COVID in our facilities. When they come in and they mask up and they do all the things that we know that we need to do to protect ourselves, people aren't catching COVID. Our internal contact tracing has shown that. It's in the community. So we're extremely grateful for Governor Walz for making the decisions that he's made, even though we recognize that they're incredibly difficult and they're incredibly hard for the people that they affect. But we're asking for people to please do everything they can to stop the spread of this virus, to mask up, to keep your distance, to socially distance, and to be extremely careful as the holidays come, because we know that everyone is desperately sick of this virus. We know that. We're sick of not being able to see our family. We're sick of not being able to get together. We're sick of not being able to celebrate. But healthcare workers are terrified of what might happen after Thanksgiving and during the holidays and after Christmas. if we're seeing people get together and the astronomical spread of the virus that we've already seen, what might happen when everybody gets together over the holidays? It's frankly terrifying to us. Healthcare workers don't get to be with their families over the holidays either. A lot of healthcare workers in this country will be in the hospitals taking care of patients with COVID. A lot of healthcare workers in this country will be watching patients die of COVID-19. That's just the reality. These healthcare workers are asking everyone in this country to please stay home, celebrate Thanksgiving with the people that you live with, celebrate with your other family distantly, celebrate with Zoom, have a FaceTime, do something like that to keep everyone else safe. Do that so we don't have to take care of you at Christmas. Do that so we don't have to watch you die at Christmas. Please, the healthcare workers of this country are pleading with you to please be careful. You're the first line of defense, not us.
Dr. Cindy Firkins-Smith, thank you.